What is all too familiar a situation? You get sick or hurt, you go to the doctor, then weeks later the bill comes and it's not what you expect. That bill can fundamentally change life for some. Kai Beach found a group making sure people get a fresh start.
It's Saturday night service at Northview Church. And as parishioners pack these pews, they start singing about the power of giving. Preaching from the pulpit,
we do the same thing spiritually.
Senior Pastor Steve Poe focuses the night's sermon on how small donations can have big impacts.
Set your minds on things above.
This Indiana-based church is truly helping their neighbors in need, with members of this congregation raising $20,000 in donations and using that money to pay off more than $3.6 million of medical debt.
That will have an impact on about 2,500 people or more.
Pastor Poe says this is financial rehabilitation through religion.
Hi there.
With his church buying 30% of all medical debt in 7 different zip codes across greater Indiana. In a few weeks, the families whose debt will be covered will receive letters.
Then they will notify their creditors that their debt has been cleared, which gives them the opportunity to start again, to start all over without this damaging debt, without this heavy debt hanging over their heads.
Northview Church worked with the organization RIP Medical Debt to purchase debt at pennies on the dollar. A study in the American Journal of Public Health found that medical debt contributes to 2/3 of bankruptcy filings. So debt relief like this can be life-changing.
I could not come up with any words. I was so caught off guard.
Lisa and Andy Soul are recipients of another Northview donation, using $6,500 to cover medical bills and other debt.
When you are granted the gift of debt being taken away from you, the amount of stress that it relieves off of your body and your shoulders is so healing.
With that kind of healing, the Souls were inspired to pass it on and pay it forward, saying it's truly better to give than receive.
I have to pinch myself to really remind myself that it's real.
I'm Kai Beach reporting.
So after you go and see a doctor, there is a team of people that work behind the scenes to figure out exactly how much you're going to pay. Our animator, Nick Refurzo, breaking down the complex world of medical billing.
How does this end up as this? It's the product of medical billing, a decades-old process that technology has recently transformed. It all starts when someone gets hurt or sick. They go to the clinic or hospital. They fill out paperwork and see the doctor. Once the visit is over, administrators ship off insurance and visit details for processing. Behind the scenes, medical coders assign each service, diagnosis, procedures, and treatments a code. Those codes help determine how much the insurance company will cover. They create a detailed, itemized list of services, medical codes, and co-payments, and send it to the medical billers. The billers use the list to create a claim for insurance companies to consider. Insurance companies can do one of 3 things: accept the claim, deny it and ask for corrections, or reject it entirely. There are a lot of variables that go into how much insurance pays. Whatever the company doesn't cover ends up in a bill in the mail. The process is digital now and faster than doing everything by hand. It also reduces the risk of human error, something that could save Americans money.
Well, prescription drug costs is a top issue. They are so high right now. Many people believe they should be Congress's top priority. We're taking a look at just how those costs impact you next.